All right, so we're going to preview the discussion for this week, which is on concussions and head injuries. If you want to extrapolate your discussion to maybe do neck injuries, that's fine too. But most of the prep material that I gave you is on head injuries and concussions, yes. So we're going to watch this video, which explains, this is the same video that was posted on the discussion, just to give you a little more background on not only concussions, but other head injuries. All right, so let's do a review. Since we just covered this in lab, I'm just going to ask questions, and you guys are going to answer them. What is the axial skeleton? This stuff, all right? Okay, the skull, spine, what else? Ribs. Let's go thoracic cage. Which includes the ribs. We're going to include the girdles on appendicular. But your hyoid bone. Your pelvic girdle we're going to put on appendicular. Okay. There you go, the ear ossicles. All right, what are the ear ossicles? Okay, good. Malleus, incus, and stapes. All right, and they run along your mid-axis. That's why we call them their axial skeleton.
What's the second one say?
Spine?
No. The
Incus?
Incus. I-N-C. Okay.
And the stapes? If you're from Cali, that's how you say it. The stapes. All right. All right, so what does our skull do? It does a lot of things, right? So it protects your brain. Has a lot of orifices, right, which are passageways for eating and breathing and listening. A lot of your sensory organs are housed within the skull as well. All right, what about our spine? We had, let's do the 5 different types of vertebrae, right? So we got cervical. How many cervical vertebrae are there? 7, right? We have cereal at 7. Tacos at 12. Lasagna at 5. Then what else do we have? Snacks. Oops, why am I writing snacks? All right, and the coccyx. How many sacral vertebrae are there? There's 4 fused together, and the coccyx has. Sorry. And the coccyx has 4, right? All right, good. Ribs, our thoracic cage, of course, that's protecting your heart and lungs. And attached with cartilage to allow flexibility there. The hyoid bone, okay, what's that doing? Yeah, so as a tongue muscle attachment. And it also protects your windpipe. Okay, so it surrounds in your neck. Okay, and in fact, injuries, like if someone is suffocated or if somebody hangs themselves, the hyoid bone will break. And that is one indication of death. Yes? Yes, just in the bottom of your, kind of at the crease of your neck. So you got your Adam's apple here and the hyoid's above it. You can feel the bumps if you, right there. Just let somebody karate chop you in the neck and they'll probably hit it. Okay? Yeah. Yeah, it does. It's very uncomfortable. All right. That's our axial skeleton review. All right, we're only going to do one, I think fontanelles is all we've got, and then we've got a forensics worksheet that you guys are going to go through, okay? And we'll explain that in a second. All right, so a fontanelle is unossified parts of the skull where the bones haven't fused yet, okay? At the junctions of the bones. At the sutures which haven't been made yet, right? Okay, so a little review. What are these two bones in the front? I'm going to use this guy. What's this bone? Oh yeah, lightsaber. Okay. Yes, this is the frontal bones. Why are there two? All right, haven't ossified yet. Okay, and there's a suture there. This suture ossifies at, any guesses how old you are when those come together?
8 years old.
Two? Good guesses. That's not correct. 3 to 9 months old. I'm talking about the suture between the frontal bones. Okay? All right. So what's this bone? Let me use my lightsaber here. What are these bones right here? Okay, good. Parietal bones. And then what's this bone down here? You guys must have just had a test on this or something. Okay. All right. Okay, so if we want to do it on here, this is the frontal, parietal. Occipital. All right. So these are also called soft spots. When a baby's born, you can see little depressions in the skull, especially the one on top, which is your anterior fontanelle, right? And when does this one ossify? At what age? Oh, good job, guys. So this is the last one to ossify. It's also the biggest one. And after 2 years, it's completely combined into a suture, okay? But we have a couple other ones on the side. We have the sphenoidal.
I love that word.
Just rolls off the lips / tongue. Sphenoidal, fontanelle. Well, it's in that same area. Sphenoid's right there. Yeah. And then over here is the posterior fontanelle. Okay, and you can also see that one right here. All right, why do you have those? Yeah, so they can squish together while going through the birth canal. So I'm going to show you a live vaginal birth now. Well, an animation of one.